Hi, friends. It's an honor to be here today and to be presenting to you certain tips and tricks regarding treatment of under eye dark circles. So, this is a very common problem. However, the results of treatment may not be very satisfying. So, let's see what we can do as regards approaching the treatment modalities for such patients. I would like to thank the aesthetic clinics and its cosmetic surgery team. Let's begin with the history. So that's very important. And you take a proper history to find out the etiology of the problem, whether it's heredity, it's allergic, because of sun damage, hormonal disturbances, deficiencies like anemia, addictions like smoking, etc., lack of sleep, a lot of screen time, and of course, aging and other such factors. And this is what is more important for us as physicians, because we need to classify the dark circles into four major categories as per the appearance of the dark circles and the cause of the same. So, the a very common type is the pigmented variety, which is because of excessive melanin in the skin and they look brownish, and is because of heredity and hormonal reasons, etc. Then you have the vascular variety where poor blood circulation is the cause. It's generally seen in people who have sinus problems, who have allergies, etc. And they have a lot of congestion in the upper part of the face. And these generally look bluish purple in appearance with some amount of puffiness under the eyes. Then you have the structural variety, which is seen mostly in the later age groups with because of structural changes around the eye, the collagen loss, volume loss, bony changes, etc. And they manifest as wrinkles or under eye tear troughs or and under eye valleys, etc. So generally seen in the aging group. And then of course you have the mixed variety, which is the commonest, wherein you could have combination of all these types. Now, let's see how to categorize patients, because that is very important to decide the modality of treatment. If you can categorize your patients into the predominant variety of dark circles, it's much easier to suggest treatments, and it's much and these treatments would give much better results. So, if you look at this picture here, it's a young patient, not much of structural changes here, but you see a lot of brownish pigment. This is melanin, and this is predominantly pigment variety of dark circles. Another way of finding out is you can pull the skin of the lower eyelid laterally and see whether it's appearing brownish, whether it appears with under eye veins, it appears bluish, it has puffiness, or whether there are structural changes. So that's a simple test to find out the predominant variety of dark circles. If you look at this patient, here she has more of a vascular etiology, history wise it suggests sinusitis. She's a chronic sinusitis patient. Under eye area appears pinkish blue with some puffiness, and this suggests a vascular type of dark circle. Then, of course, aging patients who have under eye hollows, or they could have under eye bags, they could have lines, wrinkles around the eye, and this is the predominant structural variety of patients which are there. And then you have the combination type, where if you look at this picture, you will understand they have pigment, they have lines, they have hollowing, etc. So it's a combination of the different categories of dark circles. So, the standard advice that is given for all patients is to improve their lifestyle, manage their screen time, correct metabolic causes, prevent addictions, follow sun protection, and of course, topical. So, a lot of patients want something to apply under the eye. There are some good products which are available, but the only thing is that select the component or the ingredient of the product depending upon the category under which the patient falls. Okay, and these are the procedures that we do currently for such patients, again classified depending upon the predominant variety of dark circles. So if it's more of pigment, then we prefer peels and lasers. If it's a vascular etiology, lasers are preferred. If it's a structural problem, of course the botulinum, the fillers, and the laser resurfacing do their job, and surgical corrections are done if required. So let's see category wise. This is a patient who has hyperpigmentation, and here we decided to go ahead with under eye peels and combination with a pigment reduction laser, and gives very good results. So the peels which are generally used, the earlier peels like the TCA, lactic, etc., which would require multiple sessions. Currently at the aesthetic clinics, I do not prefer these peels. What we do is the multi combination peel, which needs just 2 sessions and is a combination of a lot of alpha and beta hydroxy acids. And if you look at the results, these are the results. I'll show you how the peel is done. The peel is applied on the entire face. Here, of course, we are treating the whole face because such patients generally have pigment on the rest of the areas of the face also. So we're treating it at one go. Keep the peel for around 10 to 12 hours on the face. The peeling starts a day after, and this picture on the right that you see is a lot of peeling around the eyes after this peel. So this peel gives brilliant results. Now, the lasers that are used in this part of the world for pigment reduction, we use the Q-switch ND-YAG. For vascular etiologies, we use the long pulse ND-YAG, and for wrinkle and texture improvement, we use the fractional carbon dioxide or the high intensity focused ultrasound. Now, this is how the CO2 laser is, just a small clip to show you how the CO2 laser is done. That's a corneal eye shield that we're inserting in the eye, which gives support to the upper and lower eyelids and also protects the cornea so that we could do the laser. It's a very, very good laser for resurfacing around the eyes. Now, this is a structural variety of patient dark circles wherein you see hollowing, you see wrinkles, and then, of course, you treat all these problems with the Botox toxin, the fillers, and the laser resurfacing to give you results like this. A similar category of patient with under eye lines, with valleys, and with pigmentation treated with the toxin, the filler, and the resurfacing to give you good results. A very young patient, sometimes they have mild under eye puffiness, which they feel is giving rise to appearance of dark circles. Such patients, just mild tightening of the under eye skin can give very good results. This was one session of the HIFU that was done. And a similar patient, a young patient, but having under eye bags, not very predominant, but she feels that it gives her dark circles, and under eye filler, and one session of HIFU is what would give the results. So, to summarize, under eye dark circles are one of the difficult problems on the face to treat, and realistic expectations must be given to patients. A proper diagnosis of etiology and treatment is required, and combination therapies work best, in my opinion. And thank you so much for a patient listening.